Hello, Dr. James Bogesh, expert in health and longevity, and today we're going to talk about the scary C word and make some correlations between breast cancer and prostate cancer. But before we go into some of the details about what you might consider if you get that diagnosis of breast cancer, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. That being said, the cancer word is very terrifying, and all too often when we hear it, we lose control. Mainstream oncology has a tendency to just, literally start making appointments for you before you've actually agreed to treatment. And next thing you know, you've got surgery and radiation and chemo and everything lined up, and you're just spinning. But what if waiting might be a better idea? Now, before that sounds completely crazy, there's two things we need to talk about. First of all is that ductal carcinoma in situ, or DCIS, is one of the most common findings on mammography. And so what we saw from 1992 to 2011, there was a dramatic increase in DCIS diagnosis because we started using screening mammography a lot more often. Unfortunately, we really didn't see a lot of decrease in invasive breast cancer and mortality rate as a result of that. So people started asking questions, and the bottom line is that not all DCIS lesions will become invasive. And I really think we need to spend a lot of money in this direction, because we waste billions on treatment that maybe might not be going anywhere. And then there's also I've had in my practice alone, I've had nightmare stories of patients who their experiences with DCIS, and whether they had lumpectomy and lat flap repairs, it just can get ugly for something that, well, maybe it wasn't going to become anything. So and that's not an easy question to answer. With DCIS, anywhere from 20 to 60% become invasive. That's a huge window. It really depends on what study we're looking at. But if we look at prostate cancer, which tracks heavily, and we're using PSA to overdiagnose, and they came up with this concept of active surveillance or watchful waiting. So you've been diagnosed. If you meet a certain Gleason score, then maybe we could just sit back and watch it and see how things progress. It was very difficult to even get men to participate in the study, because we hear cancer and we just want it out. And yet now that we've got the data on that, active surveillance is so long as you meet criteria, is a very reasonable approach to prostate cancer. So the goal is to die with prostate cancer, not from prostate cancer or even from the treatment of prostate cancer. So switching over to DCIS, very similar correlates, except with prostate cancer, I think we've done a better job of identifying which ones are going to become more aggressive. And so this study is starting to answer some of those questions of what happens if we don't cut it out. And it's still an ongoing study. They followed women for 2 years, 957, so it's just a little under 1,000 women. Average age was 63.6, and they had a diagnosis of hormone receptor positive grade 1 or 2 DCIS. So again, a very relatively narrow category, but it catches an awful lot of people who get a finding on mammography. And what they found over the course of 2 years is that in people who had treatment, so treatment is your typical radiation, chemo, and surgery, or whatever variation of that your oncologist happens to decide is best for you. And they compared it to this active monitoring, which included diagnostic mammographies every 6 months on the involved breast, and then once a year on the other breast. So they were still keeping an eye on it. And what they found is that the people who had treatment, 5.9 of them became invasive, In the placebo group, it was actually lower, 4.2%. Now, there's some reasons why that might have occurred, and there's some suggestions that it might have been in going into for the initial surgery. Maybe they found some tissues that the grading was actually greater than they thought, but it was essentially the active surveillance or the active monitoring was non-inferior. Otherwise, in other words, the outcomes were similar. Now, we need to see what happens over 5 and 10 years, and this study is ongoing. But here is my take-home message, and it's the same with prostate cancer and active surveillance. When you get this diagnosis, there is a lifestyle that likely put it there. And that's a strong statement, but the data really strongly supports things like exercise, diet, environmental estrogen exposure, stress. If you don't change those things, you're really just rolling the dice. If, however, you take this diagnosis and move to active surveillance or for prostate cancer or active monitoring for DCIS and make a complete overhaul of your lifestyle, those outcomes are going to be better. With active surveillance, we know that the outcomes are pretty good, whether you pick that, and that's without changing a damn thing. Just imagine if people overhauled their lifestyle and started doing a lot of the right things that we know are anti-cancer. That active surveillance model is just going to be stellar, and we need to look at doing the same thing for DCIS and breast cancer. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.